I hope you all are doing great today. How are you? How have you been? And let me know on the live chat, as in when you join and introduce yourself. Feel free to let me know how you have been. How's things going? What are you feeling? How's the it's a weekend in Dubai, and how is the weekend treating you? How are you all generally doing? Just let me know. So unfortunately, I was not able to join in yesterday, but we're going to cover that up today with 2 hours. Since it's going to be a 2 hour session, I thought in between, after the 1 hour completes, we'll take up a break and we'll see and we'll catch a cup of coffee or tea so that you also get a change and I also take a break from talking in too much. So today's session is going to be as promised day before yesterday. I'll be covering on mental illnesses in specific. So the topics that I thought for today are depression and anxiety. A lot of people have been messaging me and letting me about then letting me know that they wanted specifics about certain topics. So I thought we'll start off today with these two and then carry on with a few tomorrow, and we can have a great ending tomorrow, hopefully. And yeah, so that's what I've thought. Okay, I can see hello and hi Naveen. I hope you're doing good. We'll just wait in 2 more minutes before we start. So, if you're new and you don't know me, well, welcome to my live session. My name is Darsha. I'm a graduate in psychology and I'm also a member of the British Psychological Society. So, to add another fact, I'm also a brand ambassador at Tera Day. So, Tera Day is a startup organization that mainly focuses on the Minasa region. So, it is a platform that is developing, and I hope it develops soon, and the founders get to go where they plan to go. So, what Terra Day focuses on is they mainly have an Instagram platform. In their platform, they constantly share out mental health related, posts, and they constantly engage in challenges or spreading out mostly information on mental health. And hopefully, the founders get to go where they're going, and the plan is to provide a community care where mental health can be talked about and explored with so much of safety, and that safe space is provided for everyone to be and become part, and they can share freely. So that's the main agenda of the platform. I will share the link of the YouTube channel and the Instagram profile so that everyone can have a look at. And if you do like it, obviously follow it. So that's a little bit I thought I could share here. And yeah, so as in when you join, please use the live chat and get going. So for today's session, I thought since it's 2 hours, for the first hour we'll talk about anxiety, and the second hour we'll talk about depression. In between, after anxiety, we'll take a 5 minute break so that you all get to just move around, and I can also do the same. So yeah, that's about that. So let me know in the live chat, what do you think about anxiety? What are the things that you have heard about anxiety, or what is your perception about anxiety? What do you think anxiety is? Let me know in the live chat so that I know what you all know, and we can build on the session from there. So interestingly, anxiety has different concepts, and there are different types of disorders in anxiety itself. The main distinction, so I'm just going to start off an intro, and in the meanwhile, everyone can let me know in the live chat what anxiety is in your point of view, or what you think anxiety is, or what you've seen anxiety is. If no one responds, I'm just going to continue. But I hope you all give me your share of thought on anxiety, or what anxiety is in your words. Okay, so the main distinction that draws, so in every mental illness that we see, certain symptoms, or most of the many symptoms that are seen, are things that we generally have. Okay, so I can see a hello of Shweta. Hi, Shweta. So yeah, the symptoms that we generally see in mental illnesses are symptoms that we all have experienced, or are things that we all might have gone through at some point of time. So I can see a new hi from Joshua. Joel says hi. Hi, Joel. I hope you're doing good. So yeah, so symptoms that generally are seen in mental illnesses are things that, hi Kathy, I know that you're the first person who joined in. Yeah, so the symptoms that we see in mental illnesses are symptoms that we all might have experienced at some point, or the things that we generally go through. So feeling a little low. Sometimes, not the ability to sometimes not get up from bed, and these small things like being irritable, being a little tired, and a little disturbed in sleep, feeling hopeless, things like these, which we all have gone through at some points, or at some different periods of our own lives. Is there any thought anyone wants to share on the live chat on anxiety? We can go into depression in the next hour. Okay, since I don't see anything, I'm just going to start. So let me know your thoughts, your questions, everything on the chat. Yeah. Okay, continuing on anxiety. So, anxiety is a specific mental disorder. The main diagnostic tool that psychologists generally use is the DSM-5. Okay, it's a specific diagnostic manual that has it has specific criteria, symptoms to help a clinical professional to diagnose and come into conclusion that this is um, this is what the patient might be experiencing, and things like that. So this basically happens when you get to know with when you start interacting with the patient, you start inquiring what they're feeling, how are things doing, and basically after getting that trust, and when they start opening, this helps, all these type of inquiry helps you to get a brief on what they might be experiencing, and things like that. So in anxiety itself, so anxiety is a specific illness. It basically starts from the constant worry, and the constant fear that people experience. So okay, I can see a question, what should we do when we go through anxiety? Okay, so I'm going to first talk about okay, I usually feel both excitement and anxiety about an event coming up. So yes, anxiety, by feeling anxious, we all have felt anxious before an exam, or if there's an important event like Naveen mentioned. We all feel that level of nervousness, a little bit worry. What might happen, how might things go, and a little fear, and disturbances our sleep, and things like these are things that we all have experienced. But how does it become a mental illness? That is the main line that we have to draw. Okay, so basically it develops into a mental illness when we realize the fact that we cannot function properly when there is anxiety in us, like that constant worry prevents you from uh, prevents you from doing things in daily life, like you're not able to perform. If you're a student, you're not able to perform well in an exam, or you're not be able to do basic things like getting up, and doing basic chores, and so things like basic stuff starts interrupting. That is when you realize that this lasts more than a few days or a few hours that you have. So basically it keeps going. It prevents you from carrying out things effectively. That is when you realize that this is problematic. This is not what I should be feeling usually. So a general anxiety that we all face as a response to certain situations are things, like it, like just as we might experience other emotions, it is quite similar to that. But this becomes problematic. This starts becoming something of a concern when it starts overtaking you, right? So in specific, anxiety can be seen in different forms. So there's general anxiety. General anxiety is basically when a patient or someone experiences that constant fear and worry about general things in life. So they it prevents them to that constant thought and that constant feeling at the back of their mind always prevents them to carry out activities, perform things, and it does not help them to function basically how they do every day. Okay, so they're not able to work properly. If it's in jobs, they're constantly thinking. Their thoughts are engaged, which also affects their behavior at some point. So they're not able to like stop it, prevent it. So there's this continuous interruption of thoughts that prevents them, because they're extensively worried what might happen. So there's a lot of overthinking going on in the background, and this often stops them to work properly. So this is the relation to general anxiety. So general anxiety is basically about anything. It does not have to be about a specific event or a specific job. It can be just generally about life, about what tomorrow might look like, or what a week after might look like, or a month after might look like. And you just it's about basically worrying about anything. Just will I be alive tomorrow? So these kind of thoughts might be the concern in general anxiety. Then there are specific types of anxiety, which is like there's social anxiety. So social anxiety is often experienced when it's about the social aspect. So like basically interacting with people who they might not know, or even if it is with people that they know, they feel, what if I'm not fitting in with the specific group that I'm dealing with, or they're not feeling good interacting in a group, or sometimes we all get this constant I get anxious when I have to present next, or when there's a presentation, and yeah, actually even I'm anxious about how this live might go. But it's not preventing me from doing it, right? So but in when people go through the specific mental illness, their activity to perform well is paused or is halted, and their performance starts affecting. So basically they're not able to do. A certain level of anxiety is experienced by all of us at different points in our life as a result to adjusting to life, and as a result of accommodating ourselves to different events, and as responses sometimes in life. But when it starts affecting what you're doing, so in social anxiety it starts how you interact with people. So you go to a social event, or you start isolating from social events. Then after a point you're like, what they so thoughts like, what might they be thinking about me? Will I be able to accommodate properly? Am I saying it right? Is my language okay? Is what I'm saying right? Am I looking okay? But what if they don't like me? So things like thoughts that go around in the background are similar, are on these similar lines. These are just few examples that I can think at this current point. So that is what is about social anxiety. It is about, it interferes basically with your social life in simple terms. Then in specific, there is a different phobia. Okay, so phobia in specific is about how you develop the fear to certain objects. So not necessarily objects, it can be even to things like there are certain specific situations, events. So I have a very bad fear of cats and dogs. Like I can keep them as my screensavers and things like that. But if I have to see them in real life, like I'll run away. I'll start sweating. I'll start panicking. So I experience physical reactions, and I experience physical uh, tremors. Like I can scream, and I start sweating, and I'll start behaving very differently than what I'm right now. So that is kind of like my phobia. But I don't have a fear in the way that I cannot even keep them as my pictures, but I'm okay with that. I can look at the videos all day long. But when I'm exposed to that specific object, I have this great fear. Okay, I can see Kathy says the same thing. Yes, very relatable. So at specific, I still remember at specific events when, even when I am not expecting, so I'll see cats or dogs and I'll literally scream, and it gets me very nervous because like there'll be people around, and there'll be things, and they'll be like, "What? It's just a cat," and I'm like, "No," but I am very scared of it. So I like, yeah, maybe the chances of a cat or a dog attacking me is very low, but my fear is very obvious, and it starts showing up. So things, specific fears are known as phobias. So some people are scared of water, then that is hydrophobia, if I'm not wrong. Then there's trypophobia, the fear of circles. So yeah, so different types of phobias are there. Then then there's another part of anxiety, which is about obsessions. Okay, there's OCD, which we commonly use without knowing what OCD really is. So OCD is obsession compulsive disorder. While to talk about OCD, obsession is a part and compulsion is the another part. So obsession is the thought process, the cognitive part. Okay, and the compulsion is the behavior part. Joel, there's no one behind me, it's just my shadow. So the obsession part is where the person or the client who's experiencing a specific obsession. So this can be in certain forms. So mostly what we've seen in OCD is we see things like engaging in constant behaviors. That is the compulsion part. So the obsession parts where they focus is they cannot stop thinking about a particular thing, right? Then they cannot control that impulse, or they cannot control that thought, they cannot stop the thought. So this thought keeps occurring at times they don't want, or occurring at times that they don't think it might. So things like for example, most obsessions have been about cleanliness. So in the example of cleanliness, what happens is they keep getting the thought that you know what, my place is not dirty. So the compulsion part witnesses the behavior part of it, that they start cleaning it. So in OCD it starts becoming a problem. To a level we all might think that our place is not clean, and we'll start cleaning. But it becomes a part of mental illness when we start doing it as a repeated measure, right? So we do it n number of times. Like people who get to be diagnosed with OCD do it over times that, and that stops them from sleeping. Like they'll get up at midnight because they cannot stop the thought that what, my washroom's not clean. and they'll start cleaning it n number of times until they feel it, and they don't even sometimes feel that satisfaction that what, this place is clean. So this process of constantly doing it and constantly having the thought at back of your mind, it prevents the person from functioning their daily activities. So another classic example is, we all have the habit of, at least I have a habit of checking my, if my main door is locked, once or twice, but after that I'm like, what, it's locked, so I'll just leave. But if I was a person with OCD, I cannot stop doing that. Like, I'll keep coming back in the middle, and then I'll maybe I'll just take the left and go, and then I'm like, oh, you know what? Maybe it's not again locked. Then I'll come back, and this process keeps happening over a period of time. So what happens is, this eventually starts interfering with the person's life. So what happens generally is, if they're going to work, okay, imagine that they're a person who's working, so they might get late, or they might even return in the middle from office, saying that, what, I think I need to go back home. So at the back of their mind, it's that one fact that, my door is not locked. They'll keep checking over it, they'll keep getting worried over it, and that fear and that obsession starts building to a point that it interferes in all aspects of their life. So even if they're just at home, they'll get that constant this thing, is it okay, should I check again, should I keep doing again? So this is when it starts happening over a repeated number of times, and it starts taking control over all aspects of your life in an indefinite manner, that you cannot stop engaging in the behavior, and you cannot stop having that constant thought. That is when it becomes a problem. So most often, other than cleanliness, what other kinds of OCDs are witnessed is in forbidden thoughts. So thoughts like violence, terrorism, and sexual obsessions. So all these thoughts, they cannot be expressed overtly, and they resist it. So when these thoughts that they cannot engage in the compulsive behavior, it again becomes a problem for people with these specific co-series, because their desire is not met. So again, they'll start having a mental issue, that they start getting frustrated, and other emotions like guilt, shame, anger, things like these start developing. And eventually, they most of the times, either OCD patients comes by themselves, because it starts taking over their lives, or at sometimes even the patients, like family, relatives, everyone starts coming in, saying that, what, they keep doing this, and what do we do with that? So most of the treatment that has been witnessed with OCD, or anxiety in general, is based on CBT. So that is cognitive behavioral therapy. So basically, the aspect of cognition, that is our thought process, our basic thought processes in terms of memory, learning, things like these, changing and bringing modification to our cognitions and their behavioral patterns. So there are specific techniques of CBT, and sometimes even DBT, which is dialectical behavioral therapy. So specific techniques from these uh, these schools of thought are taken into consideration to treat anxiety in general, and sometimes even OCD. Because if we correct only one part, the behavioral aspect, the thought starts getting neglected, and it will repeat after a point. So addressing both is very necessary. Then another matter of fact is, sometimes anxiety develops as a cause from the environmental stressor the person is exposed to. So it might be that a person who's functioning quite healthy till maybe adulthood or young adulthood, they start developing certain anxiety attacks, or the general anxiety disorder, or they suddenly start like, experiencing social anxiety. So things like these start generally developing after some point in their life. Now, what is the root cause? Or when we start looking at how did they start experiencing this, like they were functioning quite well till now. So when did this happen, or how did this happen? When these kind of questions happen, what is generally noticed is either they might have experienced something back in childhood that is coming out after a period of time, under the influence of some trigger, right? So trigger can be of any sort. It can be something what someone said, or it can be some certain life events, and it can even be what is the person seeing, reading, watching. So, any statement or anything that the person might have seen, heard, felt, or had a conversation with, that can act as a trigger. So, most of the times, these are sometimes even unknown to the person, him or herself. So, it takes therapy to to go back to the root cause of how did this person suddenly develop something. How did this start happening? So when did this start happening? So things like when, how, why, these questions start getting addressed in therapy as the therapy starts progressing, and the person starts feeling better. So the main aim when a person from anxiety, or from certain from proper proper addressing of disorders of anxiety come in, the main underlying agenda is to sort out how they can reduce their emotional feelings, and how things can be sorted from the root cause. So, analyzing the root cause will definitely help therapy, will definitely help in finding out where and when, which will help the therapist and the person himself to be aware of what can be done better the next time, so that relapse does not happen. Though relapse is it's never guaranteed that you walk out of therapy and this can never come back. It's like fever. It can keep coming and going at times that you don't even think it will. So it is never that you go to therapy once, and there's an end to it. But definitely, as a relapse happens, and as you also start becoming aware that this is happening to me again, and these symptoms are being generated again, and things like this start coming into awareness, you start realizing, okay, you know what, I need help. So things like these come into awareness through conscious development of self awareness. Basically, how the person starts realizing by him or herself that yes, I need help. So these are the basics of how anxiety develops, and certain symptoms that I could mention. And yeah, so if there's any other thought, let me know. So I had a question before: what should we do when we go through anxiety? Realizing what is the reason of your anxiety will definitely help you. Okay, so developing that awareness, how did it start, how long is it going on for, what is the time, or what event, or what is the circumstance that I started feeling anxious? Is it just an exam, or is it just that someone asked me something and I'm just anxious and it's settling down in a day or two? Or is it getting that prolongedness, and is it going around for a certain period of time? So things like these, when you start doing that self awareness process little by little, like I said in previous lives, when you start taking a good progress of how, what are you doing in a day, or how are you spending time in a day, what are the things you're doing. So it's a certain level of self awareness that is developed, can help you to realize what is the root level. Okay, maybe sometimes, since anxiety can be a reflection or a reflex of something that has happened in the past, and it is just developed out of nowhere. It is necessary, if that is the case, then it is very necessary that you take psychological help from a professional, and like, get the root cause to treat in itself. So that would be my opinion for the question. But generally, having a good level of self awareness to understand what your causes of therapy, of anxiety is, will definitely help you to some extent on, okay, so this is the event that has happened, this is my reaction to it, these are the symptoms that I'm experiencing. So generally, it's not that everyone experiences every symptom. Okay, so sometimes you might be just experiencing a very great level of worry in life, or you might not experience the physical part of it, or it's just for a very short period of time as a reaction. But understanding how long it is going to be, how long has it been going on around for, what are the things that prevent you from doing it when you're put, and when you're experiencing the anxiety that you're going through. What about trying to find the facts? I don't understand in, like, what context is the fact finding? Is it about understanding the cause and then finding? Can you, like, make the question a little more clear? What about trying to find out the facts? The facts about how it is developed. Is that the question? Okay, and sometimes most of the mental illnesses not necessarily has to come from an environmental stressor itself. It can be a reflection of, like I mentioned day before yesterday, on the causal factor. So it can be a reflection of the genetics that you hold, or it can be as a result uh, of genetics, then this environment that you've been exposed to in childhood. So a lot of mental illnesses have a relation to the childhood experiences that a person has, or about stressful traumatic events. All these factors generally contribute to most of the mental illnesses as causal factors. Okay, what about finding facts, trying to find the facts about anxiety? Okay, so when you experience anxiety, and when you start researching about anxiety, you'll get a fairly well idea of what anxiety is about, and what so there are there are sayings that self-help books, and reading about what a mental illness that you are being put through, reading about the specific disorder or the specific illness, will help you gain a better understanding of what this might look like. Okay, so that again is a part of awareness. And especially if you understand your root cause, and you also read about anxiety, and the things that anxiety is generally about in relation to what you're experiencing, it will definitely help you to understand, and to have that level of self help, if it's possible. So I cannot say this is the right way to do it, because it's very subjective. So symptoms that people experience, and the things that people go through, even in anxiety, is very different. So sometimes some people can just experience it to a mild moderate levels, but then for some people it might be severe. So again, it depends on different cases and different experiences that people are going through. That is the thing about anxiety. So the next topic I'd like to cover is about panic attacks. So panic, okay, does meditation, before that, I have a question. Does this meditation help to get through anxiety? If not, what can I do to help myself? Okay, so meditation and yoga and other physical exercises that generally that people tell you should definitely include in your habit is the are things that definitely has a biological aspect to it. So there are certain hormones that start generating when you engage in physical activities, and when you start practicing meditation. So releasing of such hormones definitely help you to curb your mental health and your mental illness. But will it be the only resort when I have anxiety? So certain people, I myself, okay, when I used to take up mindfulness in my classes, I used to feel very anxious because I started getting out my thoughts, and I felt very vulnerable to it. So I did not find it very comfortable in my experience to take mindfulness and meditation. But again, that's why there's no right or wrong answers to what will suit, right? So it's very subjective. So if there are certain people who feel very comfortable in mindfulness, meditation, yoga, um, to release out the mental stress or mental pressures, they engage in exercises, gym, fitness, so things like that. I think, in my perspective, it's very subjective. It's what suits you the best. It's up to you how you take it, and what are the things that you reflect on. So in when used to do mindfulness, I felt that it was a stress for me altogether, because when I did not find that comfortableness in shutting down my mind, and being in the moment, and things like these made me feel very uncomfortable. But this is just my experience. I'm not saying that this will not help people, or this is not a method that should be practiced, and nothing like that. In my experience, I didn't feel very comfortable. So different experiences are for different people. So maybe if I kept practicing more on things like that, I could have felt better, or I could have been, have resort to meditation and things like that. But it basically depends on how you feel after the activity. What is do you feel good? Is that experience pleasurable? Is that something that you're looking forward to? So what is your experience on that will differ, and there's no like a right or wrong answer to, is that the way or is this not the way. So basically it's very subjective in my perspective. If not, what can you do? So if not, you realize your triggers. What is the reason? Why am I feeling it this way? So that, to understand that itself, I think it's a very time taking process. You would have to sit and reflect, or you have to maintain that progress and track out yourself, where where is it leading to these feelings. How am I getting leaded to this? Is it something I read? Is it what something someone told me? Is it the situation itself? Yeah, so things like this. But like Alan mentioned on the chat, music, meditation, yoga, things like these have amazing research, which has which provides basis to the fact that they all help in curing any type of mental illness, not just anxiety. Sometimes even other illnesses like depression and so on. But yeah, it's very subjective in nature. So there's no right or wrong base to how you can put and say this is the way it is. So that is what I have to say. If any other reflections, do let me know, or if anyone else has something else to say, do let me know in the chat. Yeah. So, okay, coming back, other than anxiety, so I had to talk about panic attacks. So, panic attacks also generally have the root cause with the extensive worry. So, panic attack, when someone experiences a panic attack for the first time, it might get misinterpreted as a heart attack, because the symptoms and the pain and most of the physical experiences in that specific moment is very similar to heart attack. So it is very important that you get medical help at that point to rule out that it is not a physical emergency, and most of the time people get into hospitals and they go see a physician or someone, and then they take it usually into emergency rooms, and because people around them are going to see it and they themselves are going to describe symptoms with similarity to heart attack. So when they rule out with the necessary obviously checks, it what happens is, it starts, okay, we gain that knowledge that, you know what, this is not physical, it is psychological in nature, and it needs to be addressed psychologically. So, panic attacks are also in similar lines of anxiety, a very severe form, because, you know, the person starts, once they have that one moment of experience, they start getting very conscious. You know, what if it happens at a point that I'm not expecting it to? What if it arises again? What if I'm in a meeting, or, you know, I'm in a very social setting, and this is what I experience? What are other people going to think about me? So these kind of thoughts will again, you know, lead to a lot of overthinking, and they'll also start getting very worried about what ifs, a lot of what ifs, and questions and thoughts like that on these lines. So it is very important that, you know, they take that necessary help, especially in panic attacks. It's kind of really very severe in comparison to the other anxiety. It again, I'm not saying it's the most severe or anything like that, but since the symptoms start getting physical in nature, and the pain that they experience in the moment is very very heavy and is very real. It's not that they're faking the pain or things like that. It's exactly like a heart attack. So yeah, but the nature of it is psychological in terms. So it is very necessary that they get treatment for, you know, in therapy, and they get, you know, they get to the biological basis also for the same corrected, because there's a lot of biological influences in any kind of mental illness per se. So both therapy and medicines are used as a form of correction in treating panic attacks. Yeah. Any reflections so far? Anything to tell me, or any answers, questions, reflections on anxiety? Do you know someone who games? Yes. So I think any sort of entertainment will help as a self help measure, that whatever the person gets comfortable with. So I cannot like say what I've said. There's supporting research to everything. There's supporting research to meditation, mindfulness, yoga, uh, music, games, everything has, seen a change in people's moods, people's psychological health if they are constantly being exposed to these things. And there's a lot of research that, you know, says yes it is, and there's a lot of research that says it's not. So it's basically of how you feel and how, what is comfortable to you, that matters. Yeah. Is there any reflections, things that you'd like to let me know? So, okay, I don't see anything. Okay. I often get a heartache when I see or go through something emotional. Is that part of anxiety or something else? So, okay, to answer that, we cannot, you know, like in a statement, or if you just experience it once or twice, or, you know, you experience it when you're being exposed to something, it might be a reaction. The difference to separate something as a, not as a mental illness, there's a very small line. So it's basically its duration. How long has it lasted for? How often have you been experiencing this? The duration factor, and what are the symptoms that you present? Is it just a pain, or Is it just is it just something out of nowhere? So if you have been a person who sees something emotional, and from your childhood, this is how you experience emotions, and this is uh, how you feel, right? That is the that cannot be a, it's not mental illness, or it's not anxiety disorder, or it's not that way. It's anxiety disorder on a disorder level. It's when it prevents you from carrying out certain things. It constantly worries you at the back of your mind when you have to perform something, when you have to work, you're thinking about the same thing. Mostly it's about overthinking. You constantly start thinking, what, okay, my life is going bad, my life is going bad, I don't know what I can do in my life. I think life is going to end this way. So initially, and even now in the pandemic, most of our thoughts are like, what is life going to be in the future? What is the thing that we should live for? We can't travel, we can't meet people in real life. There's no social, there's a lot of social distance, and we cannot touch or hug or perform our physical affection. And we cannot travel. Traveling, I think, itself is a huge stressful factor for many of us. So and yeah, so the pandemic itself, what is my job going to look like? I've lost a job. What is my financial status going to look like? So if I'm going through a set of these statements on everyday basis, for example, and it's not letting me to do anything, like I'm, imagine I'm eating, but I'm thinking this at the back of my mind. I'm walking, I'm thinking this. I'm, breathing, I'm thinking about this. I cannot even like get sleep because I'm thinking about this. And I'm not talking to anyone, or if I'm talking, my conversations are like, I don't know what to do with my life. I don't know what to do again, or I don't see. So there's so much of hopelessness, and you're so anxious that you cannot think of solutions to your problems. You cannot come up with conclusions, or you're not able to think in clarity. You're not able to console yourself. And even when people are saying you, telling you things, there's a level of pessimism that occurs, when people are generally anxious. So you can only see the negative sides. You're like, no, but what if it doesn't go? Someone says, what, there's going to be a vaccine and it's going to be fine, and what, everyone's going through. You cannot see the other side. So you'll be like, no, I don't know, I don't care about all that. But my concern is my worries, my employment, my, what is my life? This feels like a robotic life. So most of us have been going through some degree of anxiety in these challenging times, for sure. But what what differentiates us, or the feeling of anxiety at just in a moment, and the disorder itself, is how long we experience it for. How did it start happening? What is it preventing us from doing? Is it just a thought that comes and then it's leaving, and then you're like, yeah, no, it's fine, it will go and be okay. And then you're not ever thinking about it until someone else mentions to you something. So it's not happening on if it's not happening on a regular basis, basically what happens is, um, you start forgetting about it, and then you're like, yeah, it's okay. So that is not a disorder, that is just a general reaction to something that you have. That is just your way of a response, or it's just how your mind has been acting upon a particular thing. Like how we experience happiness, so we feel happy in a moment, and sometimes that happiness is for a little longer. Otherwise, yeah, you're just feeling happy, so you're like, yeah, okay. And after a point, it's fine. If that is the anxiety that you're going through, and it's just momentary, and as a reaction, like if you have a presentation and you have to speak in front of a crowd, if I'm doing this live, so these kind of social events, or these kind of events are expected to be a little anxiety provoking, right? This is expected that someone has to talk for so many hours, or you have to face a lot of people. What if the things that you say are wrong? What if So these thoughts are going to be there. This is just a basic reaction of how the event is acting on you. So if you are a person who's very confident and you've done your research well, and you don't have a problem in facing the crowd, or speaking in a public gathering and things like that, then the chances of these thoughts are going to be less. But that is based on your experience and how you see yourself. So basically that's about how what kind of a personality you have, and things like that. So that is different, because this is just a momentary thing. While having the disorder is a long term process, the symptoms stay relevant for a period of time, and the symptoms starts interfering with your behaviors and your cognitions, and how you start presenting yourself. Your concept of self starts, having a very bad effect. So things around other than the experience of anxiety itself starts having a change. That is what I was also mentioning, in two lives before, that when we start googling things, we might feel like, what, I'm going through this. But there's a very thin line. That's what most of the symptoms that we see in mental illnesses are things that we all have gone through, or we all go through at some point in our lives, as reactions and responses and general way of living as human beings. It becomes a disorder when people don't, when that problem or when that reaction starts taking over you. So when it starts affecting all segments of your life, that is the basic difference. So it might be not, as Shweta's, in response to Shweta's question, it might be not um, disorder in itself. It might be just that you are experiencing that, or you have been experiencing your emotions the same way from your childhood. When you see emotional things, you just start to feel a little, what, oh my god, kind of thing, and then you start having that physical response, and that's how it gets. So is that might not really be a part of anxiety if those symptoms don't interfere with your daily way of life. Would be my answer to the question. Are there any questions or reflections or so on? If there is nothing, we'll take a break for about 10 minutes and we can start on depression. I hope, Shweta, the answer was sufficient to your question. If there are no reflections, and if there's something that catches you in the 10 minutes break that we all have, then definitely let me know when we start the next session. The next session is about depression, and specific to depression. And yeah, I'm going to look forward to a lot of participation in depression. Yes, so we'll take a break for about 10 minutes. I'll see you all at 5. Yeah. Okay, I'm going to end this live and we'll get back soon. Is that right? Can someone tell me yes, see you or something? See you soon. Yes, I saw at least one see you. I'm so happy. Okay. All right. Then we'll see in 10 minutes. Bye bye. I hope you have a good break.